Now, what began as a sit-down strike in a single hospital in the Ashanti region capital has spread across the country like wildfire, leaving thousands of sick persons stranded at the point of healthcare. Medical laboratory scientists across the country have stepped away from the microscopes in solidarity with their colleagues at the Komfanochi Teaching Hospital, who began last week over the appointment of medical doctors to head their laboratory. We begin from here in the Greater Accra region with Kweku Asante standing by the Kolebu Teaching Hospital. But before we speak to Kweku, let's join Maxwell Agbagba, who joins us from Ho. Hi, Maxwell. What's the situation at Ho?
Well, Daniel, the situation mirrors what is happening across the country. Here at the Ho Teaching Hospital, right behind you, you can see these red bands here indicating that the strike is in full force. Just some minutes ago, I had the opportunity to see an internal memo addressed to the acting chief executive officer of the Ho Teaching Hospital. And in that letter, the laboratory scientists here are formally notifying the acting CEO that their strike will take, it's in full force now, starting today. And they actually stated in the concluding part of the letter that they are hoping that authorities responsible for dealing with the matter will be able to resolve it so that patients who have been reporting here will not face, the inconvenience. But if you can't hear, right behind me, you can see some of these people here. They came to the laboratory to have their samples tested, but it looks like we are not getting any response as a start right now. Let me speak to a lady who has been here for the past 2 hours. Let me find out from her what the situation is. Hi, you're welcome to join us. Okay, can you tell us what the situation is? What have you been told? You've been waiting here for the past 2 hours.
Last week Friday, not last week, like 2 weeks ago, I was supposed to come back for the results today. Okay. I thought the results would just be ready because I've done the lab for some time. But still, I've been here for like 2 hours. When I left the office, I have to go back there to and I'm here. They are not telling us anything. We don't know what's going on.
So what are your immediate, alternatives?
I'm thinking of just going back home, like going back to work.
Going back to work.
Maybe later, resolve the issue.
Okay. Okay, thank you. So Daniel, that's someone who's been waiting here for the past 2 hours. Behind me, we still have more people who are waiting to have their samples tested. But like I mentioned, one of the officers here just received an internal memo, and he tells me that they're going to act according to the internal memo. That internal memo was actually signed by the local chapter chairman of their association, the Association of Laboratory Technicians here, indicating that their strike is in full force. So as it stands now, we don't know what's going to happen to the people who reported here. I'm told that for those who had appointments to come this morning, they were able to attend to them.
Right.
Those who are now reporting, there's no hope.
Maxwell Agbagba, thank you very much for bringing us those updates. Let's go to the northern region now, where pregnant women are among the hardest hit in the ongoing strike by laboratory scientists at the Tamale Teaching Hospital. Most of the pregnant women at the obstetrics and gynecology units have been there since morning, hoping for a miracle. Others who can afford have had to go to private facilities in town for their various tests. Now, the polyclinic is also closed to the public as red bands have been tied and the place has been locked. The main laboratory where most of the activities normally take place is also locked with patients loitering around. Staff at the hospital who spoke on condition of anonymity said even though they are staff members, persons who are connected to them have been denied healthcare. So they've had to seek those laboratory tests elsewhere. Martina Bugri is on the ground and joins us with updates. Martina, I'm especially curious about this staff member that you spoke to. That is an indicator, isn't it? That's the situation. It's very unfortunate.
Yes, it is. He says he's part of them. When they need help, they come to him. But he's in the core of activities at the hospital, and yet he has a patient. He has to seek services elsewhere for such a patient. It shows how serious the strike is. It means that any other person who comes with an issue would have to look elsewhere, because even they who are part of them are not getting the service.
What are the patients themselves saying, Martina?
Most are complaining that it is more expensive to do the test outside the hospital facility. And so most say that they would have to go home, hoping that they call off the strike and then they can return. Because if you are supposed to have 2-3 tests at the hospital, you probably would pay lesser than if you go outside. And so they might not be able to pay for these services. So they prefer to go home and wait when the strike is over, then they will return.
From what you're observing and from what the medical staff are telling you, how is this situation affecting especially these pregnant women that you talked about?
It is affecting activities, because if you go and see the doctor, especially a pregnant woman, and then you are given a prescription to go for these tests and then to return to see a doctor, you go and then there is no service. And then you have to travel out of the facility. Most of them would go and not come back. And definitely this would have consequences on their health, especially the pregnant women.
Martina Bugri, thank you very much for joining us with these updates from the northern region. Let's go next to the central region. Richard Kojonyako is standing by there. Richard, how different is the situation there? Is the strike by medical laboratory scientists in full force in the central region?
Good afternoon.
Right, Richard, can you hear me? Right, Richard Kojonyako will join us very shortly from the central region. But here in the greater Accra region, scores of patients are stranded as laboratory scientists at the Kolebu Teaching Hospital have joined their colleagues at Konfanochi Teaching Hospital and other health centers across the country to totally withdraw their services in protest of the appointment of the 2 doctors to head the laboratory unit. Now, Joint Users checks at Kolebu revealed that the hospital's labs are not attending to any new patients since the nationwide strike kicked in this morning. Kweku Asante is at Kolebu, who joins us via Zoom. Kweku, you've been speaking to some patients. They've been expressing their frustrations at this development. What alternative plans are they making?
Right, Daniel, for some of these patients, making these alternative arrangements could come easy, but for some of them, it is not easy at all, because the cost at these private labs are much more expensive than at the government hospitals. And so we are calling on authorities to fix this situation as soon as practicable. And as I've been at the lab, I've seen very frail-looking patients come in and try and convince the lab technicians and lab authorities to take their samples for the doctors to be able to attend to them. But the lab technicians see Madam and they are saying that they are not going back to their workplaces. Although they are on ground, they are not going to attend to any patient. And so these patients are very confused, and they are saying that this situation is something that has not even come to their aid. For most of them, the first time they heard about this strike at Kolebu was when they came here this morning to seek medical attention. And so this has completely taken them by surprise. Now I've seen some of them that completely cannot walk. They came in without escorts, they came in without some family members, and I've had to call them to come for them to go to private lab, because these lab results are very necessary for the next steps that other medical practitioners within this hospital will take. So for them, they do not care so much about the situation at hand. What they want is government authorities to come together and fix the situation for their healthcare needs to be prioritized at this point in time. Daniel.
Kweku, the chairman of the Kolebu chapter of the Ghana Association of Medical Laboratory Scientists, Francis Kwachi Entry, who described the appointment of the 2 doctors of Kath as illegal. What more has he been saying?
Right, Daniel. So just like he said, according to Mr. Francis Kwachi, the appointment of the 2 doctors to head the laboratory unit at Konfanochi Teaching Hospital is illegal. And although he doesn't point to me any specific law to back this claim, what he is saying is that there should be the qualified members of the association who can head the units in Konfanochi Teaching Hospital to be able to head that unit. And so they are not backing down on their claims. They are not backing down on their demands. They are not backing down on this strike action until government resolve this situation. They are also saying that in case any loss of lives are occasioned by this strike action, then the blame must be laid at the doorstep of the government particularly the Ghana Health Service, and also the Minister of Education, particularly that he mentions. It says this situation has been with them for a while now, and they knew that this situation was going to escalate to this point, and so they should have made provisions to resolve the issues of their colleagues in Konfano Teaching Hospital. And so for them, this is a solidarity protest, this is a solidarity strike, and until these issues are resolved, they are going to continue on this strike.
Sante, thank you very much. Now, the medical laboratory unit at the Abrefi Women and Children's Hospital in the Techiman municipality remains closed after members of the Ghana Association of Medical Laboratory Scientists threatened to lay down their tools in solidarity with a sit-down strike by their colleagues at the Konfano Teaching Hospital. Now, our checks at the facility revealed that the regional branch of the group are in a closed-door meeting to discuss the possibility of the group withdrawing their services. The facility is, however, relying on external labs for all laboratory services until the meeting ends, and this is affecting healthcare delivery. Anas Sabit is live from the Bunu East region. Anas, first of all, has this meeting ended? Do we know if a decision has been taken by the regional leadership of the Medical Lab Scientists Association?
Daniel, the meeting is still in progress. The staff are still locked up in that particular meeting at the regional level, and we understand those at this particular facility are also participating or involved in that particular meeting. Here at the Abrefi Women and Children Hospital in Techiman, what we can add is that patients are asked to seek for external laboratory services from the consulting room. If you have any lab tests you have to carry out, you have to move out of the facility to the nearest laboratory to do that, and that is delaying or affecting healthcare delivery here. On the door of the laboratory units, there's this inscription where they indicated that the Ghana Association of Medical Laboratory Scientists is embarking on its nationwide industrial strike effective today until further notice, and all their members are to adhere to this directive across the country. And so they say a zonal monitoring team will visit each facility within their zone to ensure members adhere to the directive and help resolve any outstanding issue that may arise. So from this particular notice, it is quite clear that the strike action has been or is taking place already, but we still await for this particular crunch meeting. We are told is in place to see whether they may continue with their services or continue with a strike as it has started this morning.
So, Anas, help me understand this. This meeting, is it within the association or it's between the members of the association and the health authorities or the hospital authorities?
Now, this is mainly within the staff or the members of the Ghana Medical Association or the Ghana Association of Medical Laboratory Scientists. The facility has tried in, consulting the staff within it, but they told them until that particular meeting is over, they are not responding to them, and then they are not adhering to any service or attending to any services this morning. So we are waiting for the group to tell us the outcome of that particular meeting as it stands.
Thank you very much, Anas Sabis, for joining us. We'll come back to you when there's more to report. Richard Kojonyako is in the central region. He rejoins us with those updates. Richard, what's the situation with this strike of GAMLS?
Well, so it is no different from what has been reported from other regions across the country. The solidarity strike is in full force. If you go to the Cape Coast Teaching Hospital, the blood bank is not working because it is connected to the laboratory science people. And so outside the Cape Coast Teaching Hospital, you find a lot of labs for them, and these are more expensive than what is in the Cape Coast Teaching Hospital. And so the patients have to bear the brunt of the strike of these laboratory scientists. Other people that are also suffering the most are pregnant women that are also waiting for their labs to be taken, and it is it's having a rippling effect on them, and they want authorities to, as a matter of necessity, sit down with these laboratory scientists to resolve the issues as soon as possible.
Richard Kojonyako, thank you very much for bringing us those updates.